Hi, Miss Jeffries. How are you today?
Fine, thank you.
I'm going to be doing an assessment today of your skin, of your arms and your legs and your head and your neck. So first I'm going to look at your arms. Can you put your arms out like this? Okay. And I'm also going to feel you're a little warm.
I've been sitting out in the sun.
And you're equally warm in both of your arms. And nice smooth skin. And it's a tan color. You still have some tan from the sun. And I see a few age spots, a little raised, darkened lesion right here on your hand. There's another darkened lesion. This one's not raised. And we'll put your arms out straight. Okay, turn your arm over. Okay, so this arm appears a little smaller than this arm as far as the muscles are concerned. I know you told me that you broke your bones in this arm. Does it hurt at all? It does? I'm sorry. I'm sorry.
Yes, it does.
I'm trying to be gentle. I'm
yes,
sorry.
It does.
Okay. Oh, all right. Well, I'll move on down to your legs. Okay, I'm going to move on down to your legs, which are smooth and about the same white color, warm, same warmth, even down to the toes. And I see one varicosity there. Little lesion, looks like a shave
new razor
scratch, yes. And this is so there's no hair, but that's because you're shaving. And now this ankle is a little bit bigger than the other ankle.
Can I offer a suggestion?
Does this hurt?
Yeah.
I don't think I'm supposed to take suggestions from you.
Just stand over here because they're videotaping your butt.
You're right. You're absolutely right. Okay. All right. So this ankle looks a little puffier than the other one. Of course, this one's a little puffy from the sock, so I can see that there's maybe a touch of edema in both ankles. Okay. All righty. So that's the legs and okay. Now I need to look at your fingernails. I need to check they're clear, they're nice and smooth, and a good capillary refill of the nails. Okay, and as far as contour is concerned, can you take your thumbnails and put them together like that? Okay, so I see no evidence of clubbing. Okay, and I'm going to check the toes. There's one little toe here that looks like the nail has been torn off. So some dryness down here too. Yeah, good capillary refill. Toenails are a little pale. This looks like maybe a hangnail, not a hangnail, an ingrown toenail, but it's darkened anyway in that one spot on the big toenail. Okay, all right. And now I'm going to move on from the skin and the nails to your head and your hair. Okay, let's put this down. And look at your head. Head looks normocephalic, and your head is, your outer eye canthus is aligned with the pinna of your ear on both sides, so everything's in alignment. Your hair is soft, and the scalp, I'm looking at the scalp by the way, I'm not seeing any dry flakes. Scalp seems to be intact, fairly freely movable. can you move your head? Look over that way. Look over this way. Does anything hurt?
It pops sometimes.
Pops a little bit back there when you move, but
doesn't hurt.
okay. All right. Now open your mouth. Oh, felt a good click on the left side of your mouth. Go ahead and close it. Open it again. Yes, there's definitely a popping on this side in the TMJ, excuse me, temporomandibular joint. Not that that's anything wrong. I mean, that happens.
I had started when I got dentures.
Okay. All right. Let's see. So, you don't really need to take your glasses off. I don't see anything on. Well, I tell you what. I do have to touch you a little bit just to see is any tenderness here.
No.
Tenderness here.
No.
Okay. All right. All right. That's okay. That's the skin of the face and the hair. So that now we're going to move to the face and the facial nerves. Okay. Let me see. What I'm going to do is I'm going to touch your face, and this will be sharp, and this will be soft. Okay. Now have you close your eyes, and tell me, is this sharp or soft?
Soft. That's sharp.
Okay.
Sharp.
Okay.
Soft.
All right. These are the 3 branches
That feels soft.
of the 5th
Sharp.
nerve. Thank you. 3 branches of the sensory branches of the 5th nerve, which is the facial nerve. And now you can go ahead and open your eyes, and let's see. We're going to have you move. Open your jaw. Now try to shut it. Okay, that's good. Good, strong clench your teeth. Okay, and go like this with your mouth. Okay, all right. That looks good for your facial nerve. And I'm going to test your 7th cranial nerve, which is the facial exercises, the muscles in the face. So I need you to show me your teeth. Okay. Smile with your mouth closed. Okay. Smile with your mouth closed. Okay. All right. Raise your eyebrows. All right. Go ahead and take your glasses off one more time, because this time I'm going to have you close your eyes and squeeze them shut. I'm just going to try to open them, but I can't open them because very strong. Okay, that's good. Now, let's see. Purse your lips. Okay. Puff out your cheeks. All right. Let's see. Can you put your tongue in your cheek and like that? Okay. Both sides. Beautiful. Looks like your 7th cranial nerve is completely intact. Okay. Now I'm going to move on to looking at your neck. Okay. And can you turn your head over to the side? Here's your sternocleidomastoid muscle on both sides. Okay, I don't see any pulsations. I feel your, I can feel your carotid artery back this way.
That's good.
Yeah.
Glad to hear that.
Okay. So now I'm going to palpate some of your lymph nodes. So we have the
Give me my glasses off.
preauricular, and then we've got postauricular, and we've got occipital back here. And I'm not feeling any lumps or swellings. Okay, and here we have, this is the submandibular and submental and tonsillar. Okay, and then we've got, can you turn your neck to the side again? So these are the anterior, this will be the anterior cervical chain and the deep cervical chain and the posterior cervical chain. Okay, and do that on this side too. Not feeling anything unusual. You come down here to your sternal notch. Well, you don't have to pull too far down. I just have to get to the clavicles, which are, it's hard to find. Okay, there's a clavicle. So right about here is where your supraclavicular lymph node is, and both sides. Okay, I haven't felt any unusual lymph nodes. Noticed a couple of little moles on the neck. This one is raised. Looks more like a skin tag, dark brown skin tag. And I think that concludes. Oh, wait, one last thing. I have to, first of all, I have to show that I'm not using any notes, as if it's not painfully obvious. And and then, oh, I have to palpate your thyroid, which is going to be fun to find on you. Let's see, again, the sternal notch. So this is the larynx here. Thyroid should be right about, yeah, right in there. Okay, feels even. Don't feel any nodules. And I'm supposed to listen to your carotid. Okay. That's even. And also listening for bruits over your thyroid. Don't feel any, don't hear anything, and I don't see any jugular distension. And that concludes our examination.